Hi, I'm Mark Sweeney, owner and founder of Austin Dental Spa here in beautiful Austin, Texas. One of the most common questions I get is, do you take my dental insurance? Well, a brief history of insurance and the whole business of insurance might be helpful. My dad was an insurance agent in a small town outside of Houston, and insurance put me through college and my three brothers. So I know a little bit about it, and the whole idea of insurance is to take in more in premiums than get paid out in claims. That's how the insurance companies stay in business and make a profit. With health insurance, quite a different thing. With health insurance, especially medical insurance, you're covering yourself in case of a catastrophic event that you wouldn't be able to afford the hospital stay if you were in a car accident or broke your leg. Dental insurance is quite a different animal. It's only been around for about 30 years. So I practiced the first 10 years of my career without having to worry about insurances. And now that dental insurance has started, back 30 years ago, they only paid $1,500 a year. But now the premiums have quadrupled, but they still only pay $1,500 a year as a maximum. So you can do the math and figure out where's the rest of that money going and what's happening. Insurance companies also know that the average American only goes to the dentist when they have a toothache or a problem. So 50% of their people that are paying premiums never file a claim. So that's how dental insurance companies stay in business. Now, about 20 years ago, insurance companies took it up a notch and decided to make in-network versus non-network. So they contracted with dentists who signed contracts with the insurance company agreeing to only charge what the insurance company was willing to pay for treatment. Well, that seems like a great idea at first, but if you're the dentist, not such a great idea, because you either have to see more people in a day or spend less time on each procedure, and you have to control your costs with the type of people you're going to hire, the amount of technology you're able to afford, because the insurance company is basically controlling your business. And so I made the decision a long time ago that I'm not going to have an insurance company dictating what treatment goes on in your mouth. That should be between you and me as the dentist and patient, and then the insurance company should pay whatever they're going to pay. We have people that specialize in my office in trying to get as much coverage for any dental treatment that you have done here at Austin Dental Spa, but insurance does not dictate what treatment is actually going to get done. We get to know, we're a relationship-based practice, so we're going to get to know you, we're going to get to know all about you, we're going to find out what your goals are, what kind of health level you want to achieve, and then figure out a timeline over which we can achieve those goals with you. If you've got a budget, we take that into account as well. So all that doesn't typically happen in a in-network dentist, because they're shooting for trying to get as much done in as few appointments as possible and not really worried about building any kind of relationship with you. So you're going to get quite a different experience here at Austin Dental Spa than you would get at an in-network provider. One of the best analogies I can think of is the Kia dealership versus the Mercedes dealership. One's made mostly by hand in Germany, the other's made in Korea, and they're mass produced on an assembly line. There's not a whole lot of personal touch going on to them. The price is quite different too. If you go into a Kia dealership, they're looking to sell their cars based on price. At the Mercedes dealership, as you well know, they're selling quality. The quality of the product, the status of driving one, the fact that they're going to hold their value well, and they're going to last a long, long time. Both of them have four wheels, but both of them get you from point A to point B, but in quite different style. And so it's all about choices and how do you want to receive your dental care. If you want a personalized touch in an environment with compassionate, caring people, Austin Dental Spa or a fee-for-service practice is relationship-based is what you're looking for. I hope that's been helpful.